And we're live.
Okay.
Over to you, David.
Good evening, and thank you for joining us today on discussions around prostate cancer awareness. I'm your host, Dr. David Burton, and this is a series of webcasts that we have hosted by the Jamaica Diaspora UK. And this is a really important topic to be touching on, particularly this month. We're touching on prostate cancer, and we have some really special guests on the line. I'd like them to all introduce themselves in due course. But thank you again for joining us through Facebook and YouTube. And we're happy to take questions throughout. So please just post your questions on Facebook or YouTube, and we'll endeavor to answer those throughout as well. So first special guest that we've got, just to like you to introduce yourself. We have Denton Wilson. If you could just give us a little bit of a flavor of your background, Denton.
Yeah, Denton Wilson. I'm a prostate cancer awareness community champion. I do quite a lot of extensive work up and down the country, as far as Jamaica, America, talking about prostate cancer. I was a delegate of the diaspora. I did quite a lot of work in Jamaica, talking on the issues around prostate cancer. I've written a book called A Man Dies Every Hour, but now it's changed. It's now A Man Dies Every 45 Minutes. I am a natural bodybuilder. At the age of 42, I was diagnosed with prostate cancer and was given 8 weeks to live. And through the help of God and his guidance has helped me. I didn't have chemo or radiotherapy because I knew that wasn't right for me. And I just did it all the natural way. And like I said, I was 42 years old, given 8 weeks to live. I'm now 65 years young. I am also #1 in the world of a natural bodybuilder for the over 60s. So I've achieved a lot, and I've tried to do quite a lot of work within the Black community. It has been very, very hard, and it's still hard, and I'm trying my best to get in there to try and save a lot of men's life.
Fantastic. Thank you so much for that introduction, Denton. We'll touch on some of those things you brought out there in due course. So thank you very much for coming in this evening. Next up, we have Pamela Campbell-Morris. Pamela, would you like to just introduce yourself, tell us a little bit about your background and what's led you to this event this evening?
Yeah, sure. My name is Pamela Campbell-Morris. I'm 62 years old. I'm a mother of 2, a grandmother of 5, and I work for the Center for BM Health here in Leicester and the University of Leicester U Matters project. I'm also known as a community health activist. I have managed several voluntary sector organizations, including mental health organizations in the past. And I'm really passionate about positive changes to the people whose voices are seldom heard. That's me.
Fantastic. Thank you so much for joining us this evening. I really appreciate it. And obviously we'll tap on a lot of the community aspect with yourself very shortly. And I'm sure we'll be able to share a video a little bit later on, hopefully as well. Next up, we have one half of a duo. The second half isn't just here yet, but we've got the primary half here in Chidi Maluku, Dr. Chidi Maluku, who's a consultant urologist. Chidi, thank you for joining us this evening. Just to give us a little bit of a flavor about your background, if you will, please.
So I'm a urologist by training. I did my medical school at the University of the West Indies, and so I'm quite pleased to be associated with this program tonight. Since finishing medical school, I've done postgraduate training mostly in the UK, but a little bit in Canada as well. And my clinical and research interest is in prostate cancer. And being a Black man myself, I'm quite aware of the impact it has on the Black community and the Black man. So I'm quite happy to contribute my little quota to spread a bit of knowledge and to help Black men to engage with this topic, because it's not going away.
Fantastic. Thank you so much again for joining us this evening. And I just see logging in now a second half of the duo of consultants within the urology fraternity. We've got Mr. Dr. John Makanjola, who's joined us this evening as well. John, just tell us a little bit about your background, if you will, as well. That'd be perfect. Thank you so much.
Yeah, thank you for having me. Apologies, I had some IT problems earlier.
So my name is Jonathan Mackingell. I'm a consultant urologist working at King's College in London. I'm West African heritage, so my dad is from Nigeria. My mum from Sierra Leone. I'm married to a Caribbean woman, my wife's from Bermuda in the Caribbean. And over my past 3 years as a consultant, I've been really kind of working hard and trying to, in terms of men's health and Black men's health. So I'm the national clinical lead for Blood in the Urine campaign for Black and ethnic minorities. I've also worked and trained surgeons in the Caribbean and in West Africa in terms of advanced prostate diagnosis. And really just trying to, and I was a recipient of a large National Institute of Health Research Award looking at artificial intelligence in prostate cancer diagnosis. We were able to secure £1 million towards that. And I think that will really help in terms of using technology to help break down the health inequalities that exist in prostate cancer.
Fantastic. Thank you so much for coming in this evening. And again, we'll touch on a couple of those topics in due course. Thank you very much for the introductions. I think now is probably the best time to pick up with yourself, Chidi, in regards to the slide set, talking about what is prostate cancer, because people probably watching thinking, well, what's prostate cancer? What is that? What is it all about? Can we see it? Where is it? So let's get a slide set up if we can. And I'd like you to just talk through, if you would, for us this evening.
Okay, so thanks again for giving me the opportunity to talk today and to share some information. The first thing that comes to the minds of most men when you say, you talk about the prostate, they wonder what is it and where is it? So the first thing is to talk a little bit about what the prostate is and where it is. So it's an organ that's part of the reproductive system in a man, and it sits just under the bladder, and the urethra, which is the tube that drains your bladder, passes through the prostate on the way out. So that's where the prostate is. Next slide, please. So in terms of function, about half of or a third of the ejaculation fluid that comes out in an ejaculation is actually from the prostate. And so it's really part of an integral part of the reproductive system. And with age, cancers could form there. It's just part of the aging process in a man. And most men will get prostate cancer as they get older. The problem is when it happens when you're much younger, then there's a chance that it could actually grow and cause you problems in your lifetime. So it starts as a small growth, and then over time, it gets bigger and bigger. And initially, there are no symptoms. So if you're depending on symptoms to prompt you to see your doctor, you might be too late. So by the time you get symptoms, it means it's already starting to press on surrounding organs. So we don't want it to reach to that stage. Next slide. So Prostate Cancer UK is one of the main charities for prostate cancer in the United Kingdom. And they've put out quite a lot of information. They've got a very good website with lots of information, easy to read and easy to follow. So it's one I really encouragement to look at. And it has various pages that focus on the risks for Black men and encouraging Black men to know their risk for prostate cancer and to seek attention early. Next slide, please. So prostate cancer is one of three main problems that a man could have with his prostate. There's other things that could happen, but today we're going to focus on prostate cancer. So I'm just going to stick to that part of it. Next slide. You really need to know about the risk of prostate cancer. So a lot of Black men don't like to engage with the topic, but this is problematic because Black men have even a higher risk than the rest of the population. So as a Black man, your risk is at least twice as the general population. Now, if you have family history, which is either a father or a brother that has prostate cancer, that even bumps your risk up higher. And once you get over the age of 50, then you're really, or sometimes even earlier for a Black man, you're really at risk of developing prostate cancer. Next slide. So talking about symptoms, there are certain symptoms that you could get that are related to urinary tract, which might suggest that it's a problem with the prostate. But again, for a Black man, I would suggest or strongly encourage that you don't wait for these symptoms to actually talk to your doctor about your risk of prostate cancer. Next slide. As I've said a number of times now, most men with early prostate cancer will not have any symptoms, so you can't wait for the symptoms. Next slide. Again, not to bang on too much about it. If you're Black, you're at higher risk of prostate cancer. You need to see your doctor. You need to engage with the topic, and you need to get checked out. Definitely before you reach 50. I would suggest from the age of 45 for a Black man. Next slide, please. So what can you do? Again, talk to your doctor early. If you're not getting any joy with your doctor, Prostate Cancer UK offers a helpline. You can speak to their specialist nurses, talk through the situation and get some help. Also, talk to other Black men that you know about the topic. It's not a taboo. It's a simple, natural process that happens as we get older, and it's not something to be ashamed to talk about. Next slide. As I said earlier, the Prostate Cancer UK website has a symptom checker, or like a risk checker, which just helps you assess your risk, and it's very quick, and it just highlights to you whether or not it's time to see your doctor. Next slide. I'm guessing I'm going to have questions throughout the talk, so maybe if there are questions now, I'm happy to take them, but if not, you can save them to, during the evening. We're going to be taking questions as we go along, I believe.
That's right.
Thank you.
Thank you so much, Chidi, for that presentation there. Really insightful. Gives people that sort of knowledge base as to what prostate cancer is, and we'll delve in a little bit more now. I guess question both to yourself and to John, really. We talk about risk factors there. 1 in 8 men suffering with prostate cancer, but you said it's a higher risk within Black men. How high is it?
1 in 4, so it's twice the risk for a Black man.
Twice the risk.
And then if you have a family, so if you have a father or brother, so first degree relative, that bumps it up even more by about 3. So the risks pile on each other. So if you're a Black man with a brother or father with prostate cancer, then your risk piles up even more.
Oh my goodness. So anything to add with that, John, in terms of why that risk is there?
So there's a lot of studies that are looked into it. We're not 100% sure why Black men have increased risk. And there's a lot of theories. Some people say it's due to genetics, and maybe there's a genetic reason why Black men have higher rates of prostate cancer. If you look at the population data, West Africa, so Nigeria, Ghana, and other countries, and Jamaica, Barbados have the highest rates of prostate cancer in the world, basically. And these are where Black men are. So we're not sure if it's genetics or it's hormones, testosterone. It's still to be investigated. But we know the risk is there, and it's important for all Black men to get checked. I'll give you a personal example, and I'm happy to share. My dad was diagnosed with prostate cancer aged 55. So the fact that he was a Black man diagnosed under the age of in his 50s means I'm at high risk. And the fact that I'm Black as well means my risk is higher. So I'm probably in the best specialty to get myself checked, basically. We advocate that, from the age of around 40 for Black men, you should get your PSA checked. One thing that's quite confusing for men is about PSA screening. So just as women get screened for breast cancer, there is no national program for prostate cancer screening in men. And the reason was because if you look at the population data, which is predominantly white men, they found that you need to screen over 30 men to pick up 1 case of cancer. So it's not, from a health economics point, viable. However, in Black men, I say all Black men must, at the age around 40, go to your GP and demand a PSA blood test. It may save your life.
That's what you heard here first. So first of all, age 40, Black men, go and check yourself into a GP. Despite COVID crisis and everything else, you need to get yourself checked out. And I always advocate that, all men have a well men's check over the age of 40. And so please, you heard there, get yourself checked out. Now,
and so David, if I just say the risk, just to add to what Jonathan says, is definitely genetic, because most of the Black men in diaspora have come from the West African coast, going all the way from sort of Sierra Leone all the way down to sort of Gabon, Congo area. and the risk of prostate cancer there is really high. And then you go to diaspora and it's the same thing. So, I mean, there's also environmental factors, but the genetic factor for Black men definitely seems to be quite strong.
Fantastic. Thank you so much for filling that in as well. You know, the genetic factor being the way that it is, it's something that we can obviously delve into in terms of research as well. But I just want to go on to Denton. We talk about genetic factor, risk of family history. Tell us about your course of how you became diagnosed with prostate cancer.
Well, I didn't know my father. I came to England when I was 9 years old. I was told that my father was dead. So I had no recollection of what my father was. But I got into an instant family. My mom married. I had a father which was very good to me. But I started to have dreams when I was in my teens about this man calling me. And this dream got stronger. And I asked my mom about my dad. It just begged me to question about my real father. And she says it was dead. It was dead. And the dream got stronger. And I vowed when I was old enough, I would venture to Jamaica. It took me many, many journeys. And it was at the age of 42, I met this man. And the man that I met was the same man in my dreams. You know, this is how good God is. I met this man, and he was my father. I knew he was my father, and he fit the jigsaw puzzle in my life. Why it wasn't a part of my life, and I was with him for 2 weeks. The first week was great. The second week, he fell ill, and I watched him deteriorated. And it was when I was ready to come back to England. He said to me, "Son, I need to tell you something." And he said, "I've got prostate cancer." I didn't even know what prostate cancer was. He goes, "I want you, when you go to England, please see what you can do for me, help me, you know." And I said to him, I said, "Dad, I've only just met you. You know, 42 years old, I've just met you, and I'm not going to give up on you." So I went back to England, give my farewell, tell him that I love him and I will see him. And I went to England. When I got to England, I got a telephone call to say that my father was dead. And that was a shock to me. I quickly borrowed money, went back to Jamaica so I could be with my dad and my new family that I've never met. And there was something that were telling me that there was a reason for this to happen. And I prayed to God and asked God for guidance. And I just said, I'm going to go to my doctor when I get back to England. At first, my doctor would not see me. I kept saying, I need to have this test. Is there a test? He goes, "No, you're fit, young, healthy man. You don't need no test." And I was reluctant to come out of his surgery, you know, and until I told him, I said, "Listen, my dad has just died. I need to know." And sure enough, I got tested. I had a PSA test, and I was told to come back. And then I was told to come back. So I had a few tests, and then it sat me down and it says, "You've got cancer." That's how I found out that I got prostate cancer. They did a biopsy, they did some more tests, and they found that the cancer was quite aggressive. And they give like an indicator of how long I had to live. I had roughly about 8 weeks. If I didn't go to have chemo or radiotherapy, it says I'm gonna die. And I felt horribly sad and angry with God, you know what I mean? But God was there to guide me, and so I asked God for guidance, and God says in my head, saying, "Don't have the chemo, don't have the radiotherapy, but look at all the things that I've given you, all the natural things. That's what's gonna help you through." But the prostate had to be removed because it was like I said, it was aggressive, and we didn't know how. So I had to actually have the prostate removed.
I've got you.
And
Thank you
and
so
I pray
much.
to God. Yeah.
Thank you so much. So I want to just rewind a little bit there, just to find back some questions for our urologist colleagues, just because you talked about the diagnosis, you talked about a PSA test. I just want some examples of how is prostate cancer diagnosed?
The first thing is the basic assessment is a PSA blood test and a prostate examination. So these are the two basic tests which men should not be scared of. we're all entitled to this, and the sooner you have it, the better. So a PSA blood test and a prostate examination. Now, prostate examination, some men don't like it because it needs a finger going through the back passage to feel the prostate. But I must say that that's probably the most useful examination you're going to have in your life. So I would ask men to engage with the process. There's no shame in it. There's nothing to lose. It doesn't change who you are as a man. I know in some communities where there is homophobia, they have all sorts of connotations about the process of having a finger through your back passage. But if it's going to save your life, then why not?
Fantastic. So those are the two kind of tests. Anything to add on in terms of diagnosis there, John?
Yeah. So one of the sea changes in the management of prostate cancer is the use of imaging. So in the old days, we'd do a digital rectal examination, a PSA, and you'd be having to biopsies through the prostate. And obviously the biopsies themselves can be uncomfortable. Men get stressed about having them. One thing that's changed in the last few years now is the use of MRI scans. So we're actually using MRI scan as a tool to try and risk stratify who needs a biopsy or not. So men will get their PSA blood test, they'll get their examination, and they'll go straight to MRI scan. And if the MRI scan shows there's a problem, then we could biopsy those men. I know in South London, the practice is slightly different in some parts, but in our unit in South London, near Brixton, we do the MRI scan as a screening tool, and then we go on to decide if men need the biopsy and do it that way. So we are reducing the number of unnecessary biopsies we're doing and reducing the harm as well. Even the type of biopsy we're doing is a slightly different technique. So rather than doing the biopsy through the rectum, we do it through the skin above the rectum called the perineum. And it means that we reduce the risk of sepsis and discomfort significantly. And we've had really good patient satisfaction from the type of biopsies we're doing. So there are a lot of new things and new techniques in terms of diagnostics of prostate cancer available to men in the UK.
Fantastic. So we've gone through the realms.
The MRI is really good. Just like Jonathan said, it's about 90% accurate at ruling out any suspicious areas in the prostate. So whereas before, like Jonathan said, you do some biopsies from different parts of the prostate. Now with the MRI, it shows you where to go with the biopsy. And if the MRI is clear, you're probably about 90 to 95% confident that there's nothing to worry about at that point in time.
Fantastic. So that goes back to the point that you're talking about, the resistance to people having examinations through the back passage, really. And that might well be a manifestation of issues within our community itself. And Pamela, just touching on that, we've talked about sort of people's resistance possibly to see a GP or a specialist in regards to prostate cancer or having examinations of the back passage, etc. What sort of issues have you found in regards to your community engagement in that matter?
Yeah, well, if I may say, I was aware of the 1 in 8 men may, get prostate cancer in their life. But when I become aware of the stats with Black men, 1 in 4, I thought I want to do something about it. As I've said earlier on, I'm a mother, a grandmother, a wife, and a sister. I wanted to do something. And through the organizations that I work for, the Center for BME Health, Prostate Local, and University of Leicester, You Matters, they all listened to me. We all know that domino is a big game around the Caribbean and all over the world, really. People enjoy playing that. So I thought, okay, I want to engage with Black men through Domino, the Play Domino Talk Prostate campaign. But for me, I wanted to reach those very grassroots men who don't normally engage with health. And that's why I felt that's the approach I want to use. The first video we did, which is on YouTube, called All Rise, a counselor rang me after being in America on holiday, and I've seen Black men who he knew from Leicester. He was impressed. He knew those men don't normally speak up, never learn about health. So that was the first encounter, getting men together. Now, with your question about what we've come up on within our communities, yes, we've done a book. The idea came about, and the organizations supported me. I wanted to do a comic book, so we commissioned the work for a writer to do the comic book with the men, carrying my ideas and the men sort of ideas. And if you look at the book, you'll see where they talk about the finger in the batty. As we call the batty is the bottom in the Caribbean, but it is a standing joke. But I wanted to capture men's perception in that book, factual and anecdotal. And we've also gone on to do the animated version in authentic patois about the finger in the batty and going to pee all the time, wee, as we call it. And now, I must say, as a result of this campaign, of which was launched 2 years ago, and very, very proud of that, because considering we're saying men does not engage very well, we had over 80 people turned up at that launch, mainly Black men. And being media savvy, it was covered by East Midlands News, which means it went right across the East Midlands. And from then, we've been running 3 weekly sessions of domino sessions here in Leicester, which men are very receptive to. In September, we put on an event here in Leicester where we had 6 cities: Birmingham, Wolverhampton, Nottingham, Leicester, Northampton, and Coventry, and Oldham. Over 200 men attended a domino event. I had a speaker in who spoke to them, and they were so impressed. Black men and dominoes, they don't listen, but this Play Domino campaign is really, really resonating with not just locally, nationally, and internationally, because in Canada, on a radio station, we mentioned about the good work we are doing here. Now, I've also gone, after using the bottom-up approach, men who don't normally speak, engaging, I've now started to target celebrities. So last year, when the full West Indies cricket team was here, I got myself in through a friend and did a presentation to all 30 of the full West Indies cricket team, the coaches, the players, and their managers. I was so impressed when I was told by the manager that they've made it mandatory for all of them to come and listen to my presentation. Since then, we've had the late Bob Marley's son, Julian Marley, who have done a video with me, Wes Morgan, most recently Billy Ocean, most recently Sir Lenny Henry is on board. We've got the support of local MPs here in Leicester, and it's just fantastic. Now, I am getting men coming up to me and telling me their stories. It's almost as though I'm walking around with prostate on my forehead. I think, for me, I don't take no for an answer. And I force myself onto people. For example, I'll give you an example of me being at an event and tried to talk to 3 men about prostate, and they looked the other way. They chirped their teeth, as we know it, and didn't want to listen. I started by giving my example. 25 years ago, I was diagnosed with leukemia, because the men's perception is that I don't believe that thing is real. And I told them that should I take that attitude, I wouldn't be here now to see my grandchildren. They started to listen to me. Most recently in May, I was diagnosed with lung cancer. My work continued. I was on Radio 5, I've been on Radio Gloucester. It doesn't stop. I will not take no for an answer. I've got grandchildren who are boys, my husband.
Fantastic.
And it's just fantastic. People
Is
are listening because they have the trust and confidence in you as a community person. I do not class myself as a community leader. I am a community member.
Fantastic. Thank you so much.
Community issues.
That's great. Thank you so much for sharing that personal story as well. You know, I think sharing personal stories also helps to sort of re-emphasize the importance of seeking medical attention where you can. And, you know, it's one health condition is also linked to another. And in this regard, I think it's fantastic that you're able to sort of engage very well with community leaders, with people who are celebrities, and also, you know, get men, you know, testing themselves, getting out there. And you found a way in with the dominoes, which I think is unique. It's you know, thinking about the community and what appeals to the community. And I think you're a credit to the community at large. I would say that, you know, testing of the back passage for a bird, you know, transcends all communities. You know, I don't think there's any community that would look forward to that particular aspect of diagnosis. But finding the route in is the key. And so I just want to ask John and Chidi again. What? Sorry, I'll come back to you in a second, if that's okay, Pamela. What I was going to ask John and Chidi, resistance to sort of investigations. What sort of things can be offered for people entering the service, particularly from the Black community?
Yeah, so I'll start with that because I work in South London, so near Brixton, so predominantly Black community. So I see Black men all day, every day, and discuss them about the risk of prostate cancer and diagnostics. I think the information isn't really important. Representation is important as well. So it helps that I'm a Black man as myself. I empathize with them. I understand that when I see them in the waiting room looking sheep, if they don't want to come and see me, that they're often brought here by their partners, dragging and screaming into the clinic. And often I see men when their things are hanging off or dropping off, and that shouldn't be a situation. Black men should be more proactive with their health. And I think it's coming through in the younger generations, but the older generation, where obviously the risk of prostate cancer is higher, there's still that stigma attached in going to see a doctor. So it's trying to break that stigma down, doing talks like this, going to community centers. So I do a lot of church and men's groups, really trying to come down to men's level, their own environments, and say, look, this is real. This is something that can be done, and try and engage them on that personal level to try and encourage them to get tested.
Fantastic, thank you. And Chidi, any thoughts on that as well?
I agree with Jonathan. Seeing you as a urologist, you look the same skin color. You're able to break down the information for them in a way that they can understand. So that barrier that might have been there is no longer there. Mm-hmm. And you can just talk to them, man on man, and just explain, look, this is what you need. You're a Black man, your risk is higher, you can't dodge it. So you just engage. So I think it helps to see someone that looks like them, to be honest. But again, going back to the Prostate Cancer UK website, they've got a page that's just for Black men. So that helps as well. So if men find themselves in a situation where they're unable to engage, they can go online and read for themselves. There's a lot of material that's just there for Black men, really. I think that could help.
Thank you so much. So, ladies and gentlemen, you're in tune to discussion of prostate cancer awareness, hosted by the Jamaica Diaspora UK, sponsored by Victoria Mutual. Thank you very much for the kind sponsorship. And we've got special guests on the line. We've got two, not one, but two consultant urologists, Black consultant urologists, one in the north of England, one in the south of England. And that's why I wanted to bring you both on today. There is a growing group of Black consultant doctors, and you've got two of you here talking about prostate cancer awareness. We're really grateful for that. We also have Denton Wilson, who's a prostate cancer champion and survivor, who's been talking to about his background, his health, and how he came to the position that he is at the moment. And we'll talk to him in just a second. But the last guest that we have is Pamela Campbell Morris, and she's a community champion, and she's been talking to us about community engagement. Denton, I hope you're still there with us.
I am.
I left you in just talking a little bit about your surgery, and we've just picked up on the fact that obviously diagnosis is tough, but having to have the idea of being diagnosed with prostate cancer, having what you went through with your father, knowing that he passed through this condition, and knowing that you needed to have a treatment. How did you feel at that moment in time when you realized you needed to have the prostate removed, and what sort of support was offered to you?
I was scared, to tell you the truth. All my faith was towards God, really, for guidance. I couldn't understand that I was having this disease. I saw my dad dying of it, really, and then I thought that I would end up the same, and my faith grew even more stronger. So, having that kind of strength in my faith, and knowing that there has to be another way, and there was another way. I'm not saying that chemo and radiotherapy is not essential, but for me, it was not. I had to look at another way, and the natural way worked for me. And this is what I try and do, is to talk to men. I do a lot of talks. It's amazing, though, the amount of talks. I've been talking to thousands and thousands of men, and most of the time, they were all white. Very small percentage that was Black. So I usually go into, try and get myself invited into church, trying to, like I said, I've been to Jamaica so many times, and it was even difficult. I talked to people in Jamaica, but it was so difficult. I was living proof that we can beat this. We can actually come out of this in a positive way. And I put myself on the line by getting involved into natural things and competing, showing that, you know, having cancer doesn't mean to say that your life is at end. You can do something about it. And that's what I did, you know. I continue doing promotion. I'm at the moment, I'm trying to raise £1 million for Prostate Cancer UK. And what I'm doing is to, I'm going to shave these locks off in order to raise this money. I had these locks when I had cancer. So I've had them over 20 odd years. And I'm wanting to raise money, but also to raise awareness of my book, because people wanted to know, how do I continue beating this disease? And I've got a book out called A Man Dies Every 45 Minutes. So I'm trying to get that promoted and get that out there to a lot of Black men, because the charity says that they don't reach enough for Black men and they don't know why. So hopefully this book, as a Black man who's achieved so much, like I said, I've been #1 in Britain as a natural bodybuilder. I'm now #1 in the world for the over 60s as a natural bodybuilder fighting cancer. So hopefully that might be able to show that there's light at the end of the tunnel.
And just a question about that, Denton, you know, in terms of being a bodybuilder, do you think it was did you have any sort of background interest in becoming a bodybuilder before age of 42 when you were diagnosed? Was that something, was fitness and such ever part of the agenda?
Well, I had no interest in bodybuilding. It was just that I wanted to beat this, and I knew I had to change my diet. I had to change the way that I was living. So I had to do exercise. I don't drink normal water. I drink alkaline water. Ever since this happened, I've been drinking alkaline water, and I eat, I drink. I make things with alkaline water, and that's actually, I feel it's played a part, along with other cancer fighting remedies that I've put together.
Okay, fantastic. And Dr. Moloku, and would you like to just sort of touch on possibly, you know, do people generally find that they change the way that they approach the situation? You know, just like Denton has said here, he kind of had a different outlook to life after having a diagnosis of prostate cancer. Do you find this is something that's a common sort of trend?
Well, it does impact you. I mean, once you get the C word, like that's a diagnosis, you know, things change. But then it depends on your attitude that's going to determine whether it's going to be a positive change for you or a negative change for you. So with the right sort of support and information, it could be a positive change. Again, depending on what stage you're diagnosed and what sort of treatment you need, how quickly you need the treatment, that determines, or you know, how much time you have to mentally adjust and adapt to the, you know, to the diagnosis. In terms of changing lifestyle, changing diet, I'm all for that. I'm all for, you know, natural remedies and, you know, dietary changes. But my feeling and what the research backs up is that these things should start much earlier in life. And so when Pam is talking about her sons and so on, it's better to start all the dietary changes early, you know, high fiber diet, vegetables, less meat, white meat, avoiding red meat, you know, avoiding fatty foods. All these things, the earlier you start it, the better. Most times, once the cancer is set in, some of these changes are not really quick enough to affect the course of the disease. So that would be my advice for people who are into the natural remedy path, which I support it fully. Start it really early.
Really early.
And one thing I would say as well, basically, I always quote this when I give talks, is that in Japan, Japanese men are probably one of the most healthy as a population in the world. They eat a lot of fresh foods and vegetables, and they're very healthy and live to quite long old age. But you take that Japanese man and move him to the United States or Western Europe or UK, and his risk for cancer becomes the same as everyone else in the population. So it tells me that there has to be something about diet and environment that contributes towards cancer forming things as well. So that study always plays in my mind. And when I'm advocating and talking to men about their diet and lifestyle, you know, think about those things.
So what you're doing is you're crucifying a lot of the food that are in the Caribbean and African communities, a lot of curry goat, the bully beef, all of that jazz. But there's a seriousness to it all in terms of the diet that we eat. You are what you eat, essentially. And I think that does play a crucial role. to the way that we live our lives. Thank you so much for sharing that for us. So Pamela, back to yourself. So we've talked a little bit about how you've engaged the community through Dominoes and the like. What sort of active projects are going on at the moment that you could inform us about going forward in regards to prostate cancer?
Well, basically, because of COVID, we're not able to do that meeting and so forth.
Oh, that the other big C, COVID.
Yeah. Exactly. But what I was going to allude to earlier on, when someone talked about the spotting of the signs and embarrassment for Black men to talk about what the signs are, the Center for BME Health, we have created a lot of resources. So what we have got here, which I don't know if you can see, but it's on the Center for BME Health, we've got the Spot the Signs, and within it is a little cue card, which we give to men. And I know you don't always wait for symptoms, that says that, but that also gives all the possible symptoms that could happen so that a man can just tick that and hand that to his GP. Furthermore, we know that some GPs are not receptive to listening to Black men. We've had that. Through my years of working with the community and starting this domino stuff, I've heard men saying they've been to the GP and the GP is saying, well, why do you want this test? We're very conscious of that, and we're working very closely with a consultant here in Leicester. We're happy to challenge those GP once we get that message that they are asking those questions. We will write to the GP and ensure that men have their test. But the other thing that I wanted to say, when we talk about Black men doesn't engage, we know the finger at the batty thing and the way how it's done. But one of the things is we must recognize is that one glove doesn't fit all. I was at a conference where a Caucasian man was talking about they've got a prostate cancer group and there's over 50 men that turn up, but no Black men. And I said to him, you won't get any Black men there, because quite often it's got to be engaging with them first in a meaningful way, getting them there, then have their ears of what, and that's how I do my work. Having to go out and say, okay, come to our event, we're going to talk about prostate. I can tell you quite often, unless the women drag them there, they're not going. So we have to have a hook. And my hook is, come on, we're going to play dominoes. And then what my approach is, which I did when there was over 200 men in there, all sitting down, waiting to play dominoes. I got on the mic and I said, right, I've got something to say and we've got a speaker here. And if you can't allow us 20 minutes to half an hour out of this day, you're going down the wrong route. And I'm telling you, you could hear a pin drop in a room of over 200 men and women with dominoes shuffling and so forth. They stopped, they listened. But as I've said, as community person, they've got to have that trust and confidence in you. The organizations that you work with, it's about them realizing that one glove doesn't fit all and give you that blessing to go forth and work within your community as you wish and as you see fit. They cannot be prescriptive. We've also done a toolkit, which is to tell people how we've engaged, how we've done this effectively, because meaningful and effective engagement is very, very important. People gain that trust. Once you do it right, it becomes easy. So this can be downloaded from the Center for BME Health website or the You Matters website, and also the comic book and the prostate cancer book, which is doing fantastically. If anyone wants any, we can send them out to them. It's fantastic read.
Fantastic, and we'll be able to post the links to books from from what you've just suggested there, and also Denton on your side as well. We'll be able to post those at the end of the show on our respective links on YouTube and Facebook. Thank you very much for sharing those. One of the things I wanted to touch on with Jonathan, if you will, you talked about this National Institute for Health Research grant. It's a big grant, big pot of money, £1 million for artificial intelligence kind of research. Can you talk to us a little bit about that, if you will? Because I think it would help to sort of break down those barriers of impediment when it comes to people thinking about having digital examinations, rectal examinations, I should say, and possibly coming into to hospitals, etc. So yeah, just tell us a little bit about that, if you will.
We apply for a grant basically using digital technologies. How can we use technology to try and enhance and improve patient care? And one big area is use of artificial intelligence. So using computer software and systems that analyze patient data, such as your PSA, your prostate size, and using the best guidance internationally, try and work out what's the best treatment for you using a number of parameters. So when all cancer cases are discussed in NHS, they go through something called a multidisciplinary meeting. So that's a whole group of doctors that discuss your individual case. Nurses, doctors, pathologists, so people that look at the samples, and x-ray doctors. All gets looked at, and we spend time discussing the case and then decide on the best treatment. But as you can imagine, this can also be an anonymous kind of non-patient focused meeting, because it's met once a week. The patient's not really involved in that discussion. And then in the clinic, you see your specialist and they present you the options of treatment. So we're bringing the patient at the heart of this and using artificial intelligence. So what happens is the patient will then fill in the online questionnaire based on their symptoms and what's important to them. For example, prostate cancer treatment can cause erectile dysfunction. It can cause fertility problems. So for some groups, that's really important, and that may guide you over having surgery versus radiotherapy or watching the cancer. So the software puts all these things into the mix, and then we'll give you your answers based on personalized responses. So it's really, truly personalized way of doing healthcare, basically. And it really puts the patient at the center. So we're collaborating with Prostate Cancer UK. It's King's College Hospital and Guy's and St. Thomas's with the grant base. And we're going to start doing the research in January of next year, basically. One thing I'll talk about research is there are not enough Black men getting involved in prostate cancer research. It's one of the biggest killers of Black men, and we know that it affects Black men disproportionately. Yet, in all the big major studies, so there's a trial, one of the biggest studies of prostate cancer in the world, a Scandinavian study, and there's studies in the UK, and less than 1% of Black men were enrolled in the study. So you've got a disease that's disproportionately affecting us, but we're underrepresented when it comes to the trials. And that's a really big problem. And I think that's another issue that needs to be addressed.
Fantastic, thank you. And Chidi, would you like to voice any opinion on sort of research and encouraging maybe Black people into research, or Black men into research specifically for prostate cancer?
Well, without sounding cynical, people tend to focus on problems that affect them. And most of the Western countries that have, big research projects and teams and so on, they're majority white populations. And, it's just in the 60s that Black people got to vote in America, So many of all these other things, inclusiveness and so on, are still, coming on stream. So my question would be, what about the countries that are majority Black? What are they doing?
That's a good question. And I think, I think at the top of the program, John talked about sort of working in countries like the Africas with regards to raising awareness of prostate cancer and potentially research as well. I don't know if you could fill us in on that. What are your thoughts on that, John?
So I did a piece of work in Jamaica. So I met with the urologist at Mona Hill campus in Kingston and Kingston General Hospital. And we went around and we had discussions about how we can help integrate in terms of research. I think in the Caribbean and from my travels and training and teaching urologists there's a problem about health disparity. So, we have a public healthcare system in the UK, and for the pros and cons of it, it's an NHS and it works well most of the time. But in places like Jamaica, where some men haven't even got the money to go and see a doctor, or if it's a public service, it takes ages to go and see a doctor. It's just not a priority. Do you eat? Do you spend that $50 on food for your family, or do you go and see a doctor, basically? So there's a lot of barriers and access to healthcare. And I think in the UK, for as much as people complain about it, we're really blessed to have a system where it's free at the point of need. You go and see a GP, you get a PSA test, you have an MRI scan, you don't think about cost. But if I told you that in some parts of the Caribbean, an MRI scan is going to cost you $800 and your salary is, $500 a month, you just can't get an MRI scan. It's not part of your priority. So unfortunately, men are presenting with height. So in Jamaica, when I was there, we met a chap who had a PSA of 5,000 in his 50s.
Wow.
So, and I tell you, a PSA is normal between 0 and 5 based on your age. 5,000 his PSA was, and he's been struggling for a long time, but he just didn't have the money to go and see his doctor, basically. And unfortunately, he died. And Black men in these countries are dying because of health inequalities, basically.
Yeah.
And if you take someone like US, so we've done some work there based in the United States, black men are still disproportionately dying of prostate cancer. This is America, where it's got the great, the best healthcare system in the world, the most money. But again, it comes down to the haves and have-nots, people that are fully insured and those that don't have insurance. So there's still a problem with disparity in terms of across the board, be that in West Africa or even black men in the Americas or Europe.
Yeah, and so that disparity.
But Jonathan, at the same time, without sounding controversial, you also have a lot of money in black hands. So, whereas I think, okay, let me go straight to it. I think there's a problem with sort of ideas and conception that black people have, and we really need to work on it. Nigeria is a very rich black country. I don't know what they're doing there. Okay, there's money's raised and it doesn't go to the right channels. Not trying to get into politics. Yeah. You have many other countries that, the priorities are not just there, and a lot of the funds that should go into healthcare is coming back to Europe and being spent on, luxuries for politicians and their relatives and so on. So this is money that could be invested into healthcare. So I think we as black people, both at national and personal level, we do ourselves a lot of disservice by not focusing on priorities. Health is a priority. So we need to think about how we engage at a political level to invest more money in healthcare in the black-dominated countries, the black majority countries, because if you wait for the white majority countries to attend to your healthcare, for example, you could have an Obama presidency where you have the Affordable Care Act, and then you have a Trump presidency where he spends the whole 4 years trying to reverse the whole Affordable Care Act. So we have to find ways of engaging politically, especially in the black majority countries, to get black health issues as a priority.
And I think from just summarizing what you've both said there, really it's about engaging with the community that we're in and making sure that people are aware of the health problems that exist within our communities, and making sure that they're empowered to be able to make the choice to sort of seek medical attention, seek the education when it comes to the problems that they have. And yes, there's obviously the political sides that we can engage in within our communities as well to try and enforce those changes. But as you quite rightly said there, Chidi, health is wealth in respect. We need to really channel our ideas into understanding our bodies a lot better than we currently do across the board. But thank you for sharing those two tips. I was going to fire that same question. I know we're running down for time here. The hours have come a cropper. We're nearly at the hour there. But Denton, how do you think we can manage this idea of getting more engagement within our communities, making sure that people are aware? Obviously, we're running a forum like this evening, which can be reviewed again and again. But what would your thoughts be?
Well, my thoughts is I used to be a delegate for the diaspora, and I went over to Jamaica quite a number of times in order to do workshops to educate them to understand more about prostate cancer and what I've achieved, that, not to put your head in the sand. And it was going all right, but the thing is, it's all about money. I was using my pension to pay to go over to Jamaica every single time. I wanted help from the authorities over there, right? They welcomed me to do the work, but they weren't welcoming to anything. All they were saying, well, if you've got the money to come over and help us. And like I say, I only get a pension, and it was difficult, but I wanted to help because I'm a Jamaican. I wanted to put something back in my country. I still want to put something back in my country, but I also need their support. And it's about them also helping to make this possible, because I run a lot of workshops in and out, up and down the country, and it's well received. I want to be able to do that in my own country, but it's the lack of support regarding the financial help to get over there. I'm having to use my own money, which I've not got. So I have to actually stop and then concentrate on just doing workshops. I've written a book in order to get that out more, because the book will travel further than what I can.
Fantastic. Thank you so much for sharing that. I mean, it does boil down to money. You're right. It's an important thing in terms of trying to share that message. And I think what I'd like you to do at the end of this as well, if you've got the information ahead of you there, that'd be fantastic. But if you could just share the link in regards to the support that you're trying to raise for prostate cancer UK through the cutting of your locks, which I'm sure is a big part of you.
Oh yeah, that's right. Because it's a Denton donates his dreadlocks to Prostate Cancer UK. You can get online and donate and share it. I wanted to share it as many people as you can, which is trying to encourage people not just only to share it, but just to if we can get 1 million man to donate £1, you've got it. But I think people don't donate more than £1, but that's what I'm aiming for. My locks is going to go off in December the 20th. Right, that's the deadline. So it's out there. So it's Denton donates his dreadlocks to Prostate Cancer UK, and also I'm also promoting my book. A Man Dies Every 45 Minutes.
Fantastic. So we've come to the final section of the program this evening. I've been picking up questions throughout and firing them off to the guest. So thank you for answering them. The final 5 minutes, I'd just like to ask that you kind of wrap up your thoughts for this evening. I'm going to go around the panelists. I'll first start with Pamela. Hope you're still with us there. Just your final few minutes, just a minute or so wrap up of your final thoughts for this evening.
What I would say in relation to the question you've just asked just now about engaging with our community, I would say never give up. Just remember, one glove doesn't fit all. I don't know if anyone else is doing a targeted approach, because for me, the stats that we're talking about, 1 in 4 Black men, this is why I have decided with the center and the university that I wanted to do a targeted approach. Anyone can attend, but this is specifically for Black men. The other thing I would say, to engage with people, it's about bite-sized chunks. So you're not overwhelming people who don't normally engage. You're giving them little bits at a time. So it gives them that vigor to want to come back and hear more. But just lastly, in terms of research is another avenue which I know from people I engage with, they don't understand what it's about. Some of them feel that they want to be used as a guinea pig and something's going to happen. So that's another area that need to look up the understanding of research and what are the benefits for them. Because quite often people research us and nothing is done with it. It's just put away and nothing tangible came out of it. So we've got to start really questioning other people. What do they want? What are the outcomes? And what's in it for my community? You know, and so that's what I'd like to say.
Fantastic. I did say I was going to wrap up there. I've just got some really good questions that have just come in. So question for the doctors really, should Black men accept active surveillance as a treatment strategy? Isn't it dangerous for Black men when cancer is known to be aggressive?
Yeah, I can start with that one, because that's one of the research questions that we're looking at King's. So we've got a very large cohort of active surveillance men. So basically active surveillance means that cancer's been found. It's a low volume, low risk cancer, so grade 3 type cancer. And often we say to men, look, this is not cancer that's aggressive at the moment. We're going to monitor you and just watch it and see. And if things change, then we can treat you. So it's almost like delayed treatment. I am quite nervous about active surveillance in Black men, because I know Black men present with higher PSAs, more aggressive disease. And personally, I do try and steer Black men away from that. I know some of my colleagues will say, well, prostate cancer is all the same. If it's low grade, it's low grade. But, you know, I'll give you an example. So I saw a chap from Nigeria who was diagnosed with prostate, who had a raised PSA. I saw him and said, look, you've got a raised PSA, you need a biopsy. He declined. I pleaded him. I said, look, he wants to go to Nigeria. I said, look, come have your biopsy, know what's going on and you can travel. Anyway, he didn't agree with me. He left. He went to Lagos, came back 6 months later. His PSA was 10,000. He was 55 years old and died. And I felt bad about it. And, you know, I was to this day where I thought, could I have done more to try and save this man's life? Could I have persuaded him more that you need to take this seriously? You need to have your PSA checked, get your biopsy and get treated. So that gentleman still etched in my mind. And whenever I see a Black man, I think about this gentleman and it really spurs me on, basically. So in answer to that question, active surveillance in controlled hands is an option, but it has to be very, very regulated. Regular PSAs, regular MRI scans, biopsies if things change. But I am nervous about putting men into active surveillance, and that's still an area that we're still researching.
Fantastic. And Chidi, I've got a question for you. What are your views on alternative treatments to chemo and radiography? I think you touched on it a little bit earlier, but are there any other active treatments as opposed to just chemo and radiography?
So the treatments are surgery, radiotherapy, if it's early. And if it's later, then you're going to need hormone therapy with chemotherapy. And I'm all for eating healthy. I'm all for herbal diets. I'm all for, exercise and everything. It needs to start early. Once the cancer is there, once it's established, I'm not aware of any herbal remedy or any dietary change that's going to change the course of the disease. I'm not aware of. I'm not saying there's none, but I'm not aware of. When I was doing my fellowship in Canada, I came across some Native American herb that they said cures advanced prostate cancer. But you hear about these things, but they've not been subjected to any, sort of well-controlled
rigorous
studies.
Yeah. And I think there's another relation to that, which is pumpkin seed oil. Another question that came in from our audience regarding pumpkin seed oil as a treatment for prostate inflammation. I know we've not talked about prostate inflammation being prostatitis, but I don't know if, again, does that fall into the same kind of category as you just displayed there?
Yes. So, whatever it is, there's different things that are just labeled for prostate health, which is quite vague, but that's fine. Start it early.
Fantastic. So, Denton, I've just got a question here, which I would like you to answer, then I'll probably refer back to the docs. What did your symptoms look like? Did you have any symptoms of prostate?
I didn't have no symptoms. It was my dad dying was what actually opened my eyes. Like I said, I didn't know nothing about cancer. It's his death of having this disease prompt me to go and see my GP. I can further add, right? Is those who feels it knows it. People should look at people who are survivors of cancer, because people will tend to look at those people because they're living the journey. I'm living the journey. I've been cancer-free for over 20 odd years, but I was given 8 weeks to live, and I'm still living, and I'm still moving forward. So not just as me, but look at people who are actually beating the disease. Why are they beating it? We need to know that. And I think that is something that we should all look at.
That's a great point in terms of, being a survivor of this particular condition. You hold the key.
That's right.
The key to how you battle this particular condition. But going back to the docs, I wonder if you could just point to some of the symptoms that people may well have with problems related to the prostate.
Yeah, so as I said, a lot of the time it's symptomless, but men do have symptoms of the waterwork. So it could be poor flow, waking up more than once or twice a night to pass urine, not all feeling that you don't empty your bladder all the time when you urinate. Some men develop blood in the urine or recurrent bladder infections, or discomfort when passing urine as well. These are all things that are not quite normal. And as men, we like to bury our head in the sand and ignore these things. If anything's happening, you must go and see your GP, seek medical attention, even if it's just for reassurance and things are normal. If we can cure you if cancer's picked up early. If you leave it till it's advanced, it becomes more of a challenge. That's the take-home message I want to say.
Fantastic. And anything to add there, Chidi?
I'll just say the statistics are out there. We know your risks. You're a Black man. You've got twice the risk. If you've got a father or brother with prostate cancer, you've got 3 times the risk. You add this all up, then you add all the dietary and environmental factors living in the West, high-fat diet, all that, it just piles up. If you're a Black man, I would say definitely by your 45th birthday, but if possible earlier, get a check.
Fantastic, thank you. That get a check is the ultimate from this summary from our discussions this evening. Get a check. It's we're in a part of the world that affords us I would say free healthcare. We obviously pay our taxes duly, but we are able to get that check. And I think as Black men, as men up and down the country, we need to be able to get ourselves checked out, especially if you've got that family history.
Can I just say,
of course.
Talking about getting checked. On my Facebook page, there's a risk checker that's actually on there. And I think we mentioned that if men go onto that, they can actually check themselves. It gives them an indicator, it gives them an idea about cancer. And I think I would urge all men to do the risk checker. It's a very good thing.
Risk checker is by who's the risk checker by?
It's from Prostate Cancer UK.
Fantastic.
It's on my Facebook page. It says risk checker, and it only takes a few seconds.
Perfect, fantastic. And Pamela, one of the other...
So Denton, I'll tell you up front, once you click on black, it tells you to check your doctor, to see your doctor. So that's one of the things. Once you click black, the outcome
is a red flag.
To see your doctor.
It's a red flag. Go and see your doctor. We're just going to summarize it up by saying, go and see your doctor. One of the other comments that's coming through quite highly here is people really want to hear from Pamela in regards to the links. So I don't know if you've got the links in front of you there.
What links is that? Sorry.
The links to the documentation that you have there. The documentation in regards to the
the comic
cancer
book and so forth. Yes.
Yeah.
People would like to go. They can do a number of things on the Center for BME Health website, or the U Matters University for Leicester website, or they can go on YouTube, type in play domino, talk prostate, domino effect.
Okay.
And they can see all the stuff there, but also they can write into the center, and we can send out booklets of the comic books, so they can see, but they can view all the information on those websites or on YouTube. Give it a like, give it a thumbs up, leave your comments if you think it's to the point, and that would be great. And
where is the BME Centre?
The Centre for BME is based here in Leicester. Covers the East Midlands.
Okay, fantastic. Thank you so much. I'm acutely aware I've run 10 minutes over, but I really need to answer those sort of questions. I really thank you very much for your time this evening. We've got you're both doctors in the house. We've got Chidi and John. Thank you so much for joining us. Denton, thank you so much. Pamela, thank you so much. It goes without saying that this event this evening, raising obviously awareness regarding prostate cancer in the Black community, is brought to you by Jamaica Diaspora UK, unleashing that potential, with sponsorship from Jamaica Moves UK. So we're really thankful for your sponsorship, for your help, and also Victoria Mutual. We're just going to close out the end of this segment with a video. I think we've got the video prepared, ready for action. But once again, I'd like to thank the guests, the panelists, for answering questions, for preparing slide sets, for giving information to the Black community in regards to prostate cancer and raising awareness on this really important topic. And just to let you know, we're continuing with these webcasts. We've got one coming up next month that will be on the topic of diabetes. But today, thank you very much for joining us, and good night.
Thank you.
Thank you.
Thank you. Thank you.
When it comes to the numbers, prostate cancer cases in Afro-Caribbean men are high. 1 in 4 is likely to contract the disease, twice the odds of men from other ethnic backgrounds. Resistance to screening is also greater, but the Centre for BME Health in Leicester is using dominoes, something many Black men simply can't resist, to get its message across. And these specially made sets have a slogan on the back: play dominoes, talk prostate.
What I want to say, we're here for a worthy cause. Thanks to Pamela for giving us a pep talk. It's very important. It's all about prostate cancer. Check your prostate. Please go and get tested. We're going to hit prostate for 6, okay? Go and get tested. Prostate cancer.
So we want to, kick out prostate cancer, basically, and do whatever we can to raise awareness, let people know that they need to get checked, and hopefully we can catch it before anything disastrous strikes.
1 in 4 African Caribbean men in their lifetime will suffer from prostate cancer, and it's 1 in 8 men from other ethnic backgrounds. So it's really important to get the message out there about prostate cancer, to raise awareness, to get yourself checked.
Yeah, you got to get yourself checked out, because life is serious, and we need the brothers alive. And the sisters too, So go make sure you go check up yourself, make sure you're good. Because prostate is something we run with all of us,
I think it's very important that people get checked up. It's obviously very high, the actual stats. I never thought it was that high. So anyway, I can help with the People, please get checked up. Please get checked up because it's very important.
And it's a preventable disease. So it's important that we, at our age we're at now, don't have ourselves checked. I last had myself checked 2 years ago, and I was in the all clear, but I'm not taking that for granted, and I'm going to have myself checked very, very soon.
Like a lot of the people in the video had the same problem. They don't like the method of being checked. Myself, I felt the same way, but you know what? I really think it's time that I should go and get myself checked out. And I'll advise anyone that's watching or listening to what I'm saying to do the same.
Listen, Pamela Campbell Morris, huge respect to you for going all out to get black men into a place where they can play dominoes, eat curry goat and rice, and meet people, talk about this, you know, get expert advice. Often you can operate in ignorance because of embarrassment, but if you can convince people to overcome embarrassment, then they won't be ignorant anymore. So I think this is a really good scheme.